Why, hello there. Today we're going to be going over neurologic diseases. So, several different pathways here that can be associated with pain. Different types of pain, if it's chronic, acute, if it's body pain, organ pain, referred pain, okay, pain in a different location. So, a couple different things we'll talk about. So pain pathway, I think like a common thing students tend to think is like, I cut my hand, the pain is here. That's not correct. The signaling starts here, the pain is here, okay? So when you talk about, that stimulation of the pain, so substance P, glutamate, that's what's signaling it here. So endorphins block that pain. That's where morphine and all that starts to come in, your hydrocodone, all that. It is working in the brain, and that's why they work so well, okay? Endorphins and enkephalins, those are your natural pain modulators. So they're like, you ever heard of like runner's high, for example? Runner's high is where that repeat pain they're feeling as someone's running for a long period of time, and all of a sudden they kind of zone out, they don't feel the pain anymore, and they feel like they can run endlessly. Had it happen to me once. Was running, I used to run with two buddies in med school. One played soccer, one played basketball, I played video games, okay? I was a real athlete. Anywho, we used to run, it was like a 5-mile run that we would do. They always would beat me. I'm just struggle busting in the back. And then one day, I don't know what happened, endorphins kicked in, runner's high. I ran past them. I was so out of it. I ran past my buddy's place because we were into his neighborhood. Ran past his place. Didn't even realize what's going on. So that's how effective these endorphins in your own body can be for pain. So sometimes when they say, people are in shock, they get injured, they don't feel it. This could be just endorphins as well. They just don't know that they're hurt per se because it's turned off. Okay. Homunculus. So the homunculus, there are two. So one is your sensory and then one is motor. What these represent are the portions of the body devoted to these areas. And so you look at like sensory, like the lips, the fingers, they get a lot, okay? Because that's where we get a lot of input from. Motor, large limbs, same thing, like the mouth, the tongue, because speaking, okay? Facial expressions. That's just how it's distributed around the brain. So that's why someone has a stroke in some area, it affects that one part of the body, not necessarily all these random different areas. Referred pain, so you talk about this with organs, and the organ is located in one place. The pain that the patient is feeling is somewhere completely different, okay? And the reason being is like nerves are crossing, and so as those tracks cross, that's just where it ends up showing the pain at. So clinically speaking, it's important. If I get someone coming in and they're telling me, my right shoulder hurts a lot after like meals. In my head, I go gallbladder. That's gallbladder. Okay. So it's important, clinically speaking, it has great value. Temperature regulation. So really the hypothalamus is what's regulating this. Okay. There is a range for temperature. Everyone has a temperature. You have a fever when it's elevated, all right? You'll hear people say, I have a temperature. I hope you have a temperature. If you don't, we're not having a conversation here. Anyhow, hormones can fluctuate this. So like this point here, progesterone, this can be used. Women can do a temperature diary and take their temperature every day, and when they see it start to spike, they can know they're ovulating because the hormones are increasing their core temp by stimulating the hypothalamus. Okay? There are pyrogens, so there's endogenous, exogenous, so ones that we generate, ones that bacteria may have, and that can stimulate us to heat up as well. So temperature, benefits when you talk about fever. It may kill microorganisms. There are some that are more sensitive to increase in temperature, not much. The big thing is we start to use up nutrients that they may want to use. Lysosomes are more functional. Phagocytosis is increased. So cloning, clonal expansion, all the activity of white blood cells just gets upregulated. Fever is a good thing. But if we go too high, so we can get heat cramps, you can deal with that. Heat exhaustion, this is where we're starting to get in trouble. Okay, the brain is starting to be affected. There's that confusion and dizziness. Heat stroke, there is damage here. Okay, this is very, very dangerous. And people don't realize how quickly you can enter heat stroke, especially when you talk about children, elderly, people that work outside, especially in high humidity where you can't evaporate water off your body to cool yourself. So hydration is key. I remember growing up, I was a young kid, and one of our neighbors, he worked at SeaWorld, and he did like landscaping there. I was a little kid, but I remember he used to like sit in his garage and he would build, the glass bottles and they put the ship in it. He would do that as his hobby. And so it's real intricate work. The dude had a heat stroke while working. He barely could speak anymore. I remember he was paralyzed on one side of his body. He had facial droop. He had a massive heat stroke. No longer could do anything. Disabled. Right? And he wasn't that old. I mean, his kids were high school, maybe. He's not that old. Okay? So hydrate, people. You're working outside, hydrate. Okay? Take water breaks. It's important. And we see it all the time, these high school athletes that just collapse during practice. That's heat stroke. That is, they are dehydrated. And you think about it, I know y'all level. You guys don't drink water, right? I used to be the same way. Don't worry. My wife and I talked about it, and I was like, high school water? What? No, it was like Surge and Mountain Dew. Okay, and if you don't know what Surge is, you're missing out. You can find it in gas stations. Buy some Surge. I don't know what they put in there besides massive amounts of caffeine and glory and sugar, and it's just great. Okay, but that's how it used to be, and like, I don't know when, med school, something like that, just started drinking water more and more. I could not get enough water. I always have water on me, and that's important. Okay, hydration is crucial. Central fever. So this is damage in the CNS. Okay, that increased pressure, and so they'll just start developing a fever. So you see this like head trauma. They're sitting there in the hospital, and they just start developing fever, and it's not responding to like Tylenol, for example. That's concerning. Okay. Blindness. So a couple different reasons here. This is from chlamydia. This is trachoma. Okay. What happens is they get an infection in the eye from chlamydia, and the hairs, the eyelashes actually start to curve in and scratch the eye, and it causes it to keratinize. Okay. Macular degeneration. So we're looking at the back of the eye here, and there's where like the nerves and the vessels pass through, and these white splotches. Okay, that's drusen. That's these little white deposits. That is referred to as a dry macular degeneration. There is a wet. That's where they hemorrhage. They rupture these vessels. Okay, and damages vision. So when that macular degeneration, this is supposed to show you what it would look like. It just causes this blurred area. Hearing disorders, so there's a couple different. Osteosclerosis, this is what you get when you get older. Basically, the bones harden here. You also get it when you get married. Come on, that's quality. Anywho. Sensorineural, so there is a nerve damage. This is where we do like a cochlear implant, like, or if the bones they're just genetically born missing one of these 3 little bones, something like that. That's where you do a cochlear implant, and then it can travel up the nerve. So it's a little different than both of these in actuality, but sensorineural, that's something else they can deal with. Or if there's damage to the brain itself, there's nothing we can do about that. Consciousness. So Um, there is a system in here, the RAS system. And when you talk about the RAS system, that is what makes us alert and awake. And you've probably felt this system being a little slow coming online, and that's called sleep paralysis. You ever feel aware but you can't move yet? That is sleep paralysis. It happens in people from time to time. It's nothing to freak out about. However, if you have like narcolepsy, you get sleep paralysis quite a bit. So it's always like, people will always talk. It's that same nightmare people get, that someone's standing next to them, like over them while they're sleeping, and like they're aware but they can't move yet. That's the RAS system not online yet. If the RAS system is damaged, like someone has a stroke, that's where you start to get locked in syndrome. The upper portion of the brain is awake. The cortex is awake. We can see things happening, but there's a disconnect in the communication. It's the same logic of like, you pick up your house phone. If no one has house phones anymore, but you get the point here, okay? You pick up your house phone and you want to call your neighbor, but the line is cut in the middle. Your house phone works. It has power, but the communication between the two is cut. So there's nothing that we can do here. They're there, but they're not there. Okay. Different levels of consciousness. So anytime you start to see confusion, disorientation, lethargic, slurring of speech, odd movements, vomiting, nausea, this is all brain. Okay? All of those are brain. If there is certain brain damage or the brain is depressed enough in activity, breathing patterns can change. Pupils. When you see this, pupils fixed and dilated, that is very, very bad. That means there is no signaling being sent. Okay? That's very, very bad. So when they see like, one side has a blown wide open pupil, they can know something happened on that one side of the brain, and that's it. Okay? And then ocular motor responses. This is where you start to get into, reflexes, stuff like that. We don't control that. Those should be automatic responses. And so when they're lacking, we know there is a lesion somewhere along spinal cord or in the brain, depending on how high up it goes, essentially. So, all right, Cheyenne-Stokes. Cheyenne-Stokes, heart failure, brain tumors, high altitude, overdose, narcotic overdose, okay? So Cheyenne-Stokes is this guy down here. The breathing is kind of like, it goes up, 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 down, down, down. Pause, and they do it all over again. So you see someone unconscious, they're breathing like that, they haven't been in an accident, Narcan time, okay? That's where that comes into play. Because they're going to go deeper and deeper, and what's happening is the breathing center is being shut down, it's being suppressed. And the body's trying to fight it, and that's why it'll climb, but the drugs are stronger and it takes over, and it calms, and then all of a sudden it comes back. Okay? That's where they need Narcan. Biot's respiration, so this is where you damage the pons specifically. So this could be herniation, trauma, stroke, any of that. Opioid as well, but typically you talk about Cheyenne-Stokes. So Biots is these big deep breaths, pause, big deep breaths. Okay. So they are struggling. Once again, if they're down and no obvious reason, Narcan. That's usually what you're going to see like EMS is going to do. Right? And now, here at least, first responders all carry Narcan, police officers, everyone. You can buy it over the counter. You don't need a prescription for it. So it's pretty crazy. And, it's important to educate people on this because the situation is always this. Some young person ODs, the friends panic. They think they're going to get in trouble. And so they drive them to the hospital and leave them or something or play stupid. No. Call 911, tell them exactly what happened. The response team will get to you faster, and no one's going to get in trouble, okay? They cannot press charges. They cannot report it. Even if the police come, they're not going to do anything. We'd rather save a life, okay? That Narcan will get to you faster than you can take your friend to the hospital, all right? Ocular motor responses. So these are called doll eyes. It's kind of an older thing, but they still do it sometimes. So when you turn your head very rapidly, say I turn my head this way, my eyes should still try and stay focused over here. If they don't respond, okay, they go with the turn, then that is representing a brain lesion. Cold caloric response, this is also another one they can do. It's an older technique, but they inject basically on the verge of ice water into someone's ear. They irrigate the ear, and the eyes should both turn that way. If they don't, we start to know there's a brain lesion on that side of the brain. If both don't, that is an issue, okay? Decebrate and decorticate. So this is, depending on where damage is, the red nucleus. So above the red nucleus, all four extremities are extended. And then decorticate, if it's above, did I say above for decebrate? Should be below. Decorticate, if it's above the red nucleus, then we only have flexion of arms and fingers. So these populations, they're bedridden, but it's a way to identify where that lesion is. Seizures, there's all kinds of different seizures, and really what's happening is there is a unwarranted discharge of electricity in the brain. Neurons are firing off when they shouldn't be, or in patterns that they shouldn't be. So a lot of times it could just be genetic or something congenital. And then if it's not, you start to talk about like trauma, infections, poor blood supply, stroke, something like that. Overdose, there was low oxygen for a period of time. They come out, they start having seizures. Seizures is a very bad sign in those situations. Epilepsy, some people, they're just born. We don't know why. They seize when there's like flashing lights, for example. And we try and treat it with medication as much as possible. And they can find the source using an EEG, but the problem is you have to have a seizure fire off while they're being imaged. Okay. There's another one, I can't remember if I talk about it in here or not, but it's absence seizures or absence seizures. So these are in children. And what happens is the kid, it's usually the teacher that reports it. The kid will be like talking to their friend or doing an assignment, and all of a sudden they'll just stop. And they'll come back 5 seconds later and they'll just continue working. They go absent for that period of time, very short period of time. They're blanking, essentially. They don't know what's happening. They come right back to where they were. So if they're mid-sentence, they'll pause 5 seconds or so, 10 seconds, and then they'll come back and completely normal. It can cause developmental delays, stuff like that, but it's easily treatable. And they usually grow out of it. Okay. Broca, Wernicke, these are areas that are affected by strokes or certain dementias like frontal temporal lobe dementia. Alcoholics will damage it, so they'll do something called confabulation. Confabulation is where there's destruction of the brain, the memory is gone, but the brain goes, I need to fill this space. So as they're telling a story, they'll randomly just fill it with something else. They're lying, but they don't know they're lying. That's the wild part of it. There is no conscious effort to create the lie. It just happens. So Broca's broken words. So they'll say like, this is my dog. Okay. It's just a wrong word there. And then Wernicke's, they start to lose speech completely. They cannot communicate. They cannot understand language anymore. So it's rather devastating. Okay. Inability to communicate by speech, that's aphasia, and then impairment of comprehension of language, that's that loss of language, that's dysphagia. So I saw a really neat case. My preceptor put me and another student doctor as the house doctors for this assisted living facility for dementia patients. So we go there every day, full work day, and we were the in-house doctors for, I can't remember how many people were there. At least 30, maybe upwards of 60 patients. And so anything they need, we take care of. So we're doing physicals, all that, blood work, whatever needs to be done. So this one dude that was there, he was a big guy. He was like 6'8", something like that. I don't know if you can tell, but I'm like 6'2". Okay, I might be shrinking now. We're hitting that point, and I've lost the hair, so there goes a little height. But yeah, I'm a pretty tall guy, okay? And this guy was significantly taller, and just one of those naturally bigger guys. He was in his early 60s, I'd say. I think he was like 64, somewhere around there. And he used to be a successful, like, realtor. And all of a sudden, he developed this very rapid dementia. They said within a couple years, like it had started when he was like 61, and at 64, he's in the facility. He had FTD, frontal temporal lobe dementia. It's one of those wild dementias. The speed that it came on at, he probably has a prion disease, which is just defective proteins that mutate your proteins into prions. It's pretty wild. That's mad cow disease, Kuru. Okay, Creutzfeldt-Jakob. That's all like the names it goes by. The zombie deer that we had here in Georgia a few years back, that's the same thing. Okay, so in humans, it creates very, very rapid onset dementia. The only way to identify it is autopsy. Okay, we need a brain sample. But this guy lost his ability to speak, his ability to understand. And because it affected the frontal lobe, it did some other things as well that were interesting. The frontal lobe is where you have inhibition. That is our higher functioning area of our brain. That's what makes us, the ability to speak, communicate, logic, all of that compared to like animals, is the development of our frontal lobe. So yeah, this guy can't speak, can't understand, and then because the frontal lobe is damaged, apparently no sexual inhibition. So I discovered this because I'm reviewing his chart, because we took over the facility, my preceptor did, and so we had to go chart by chart and check everything, check meds, all that good stuff. And this guy's on progesterone. I called my preceptor, I was like, why does this dementia patient on progesterone? He's like, I have no clue. He's like, find out, that's really odd. Well, come to find out, they were doing it to lower his libido. Nurses and whoever else, MAs, would walk in and he's touching himself and doesn't understand he shouldn't be doing that. So that's why they gave that to him. You can't communicate with him. And then he lost the satiety center in the brain. There is no sensation of feeling full and satisfied with eating. So this guy, they had to lock all the fridges, all cabinets, anything where food was, because if he got to it, he would eat himself to death. They will, and people missing satiety center will consume food till they rupture like their stomach. Right? And it was pretty wild. He still knew time. He still could understand time, which is interesting. But he would be out there 30 minutes or so before mealtime just waiting. They would give him a plate of food, and that thing would be so clean you could put it back in the cupboard kind of situation. Just pretty crazy. I had to draw blood on him one time. He swatted at me. I was like, nope. That's it. I am not getting beat. His blood work is not that important right now. But yeah, it was sad. You walk in his room and he's just sitting in front of the TV with it off, just staring at it. He knows, like, that's TV. That's entertainment, I guess. But he can't understand it. So pretty wild. The famous story that, you may think of as Phineas Gage, the guy that got like the rebar through his head and had the overnight change, essentially. That's because it affected the frontal lobe. So that lack of inhibition, they become aggressive. That's the other point. So when like he swatted me, that's it. We don't need to do blood work. They were about to have a lot of samples of my blood. All right, MCA or middle cerebral artery. And with all these arteries, ACA, okay, PCA, if there is an obstruction in them, you lose portions of the brain. Okay, so this is basically like kind of like water shedding, if you will. There are areas of the brain that are not perfused very well, and so when you occlude one of these arteries, you can lose big portions. So we talked about cancer last, so like a tumor, okay, some metastasis obstructing it, stroke, AFib. AFib is a big causation of stuff like this, so that's why it has to be treated. Alzheimer's. So Alzheimer's is another form of dementia. Really what's happening is there is this plaque buildup, these misfolded protein structures, and it starts to obstruct the neurons, okay? The tau protein is what it's called, okay? Beta amyloid plaques, tau proteins, and it obstructs the neurons and also obstructs internally the neurons with these neurofibrillary tangles, okay? So we don't know what triggers it 100% yet. I did read something recently that they created some medication, they're testing it, where it was stopping, I can't remember if it's stopping the protein folding, the misfolding. I think that's what it was, which is pretty wild. Like we might be on the cusp of seeing something, a big treatment for Alzheimer's, which is pretty neat. So that'll be cool to see. So the problem with Alzheimer's, it shrinks the brain. If you look at how full the brain is here, the gyrus, here they're way shrunken, and the sulcus, the gaps between it are just bigger and bigger. And then you have the plaques and the tangles, and it just blocks everything, right? And, when you talk dementia's pretty wild. Like, they lose time, they lose place, they lose memory of people. It is very difficult to take care of a family member in your household that has dementia. They can become harmful. They can hurt people. They don't realize it. They can become agitated, swing at people, hit people, push people. They can get in a car and drive off. They wander off. You hear about it every summer, every winter. Elderly person missing. Be on the lookout. Was wandered off somewhere. So that's why these facilities, you have 24-hour care. They can't exit the facility because it can become dangerous. Okay? Slide, we had some of those. Okay, so here's some different types that they can put in there to help drain the excess fluid so the brain doesn't crush itself and damage itself. So there's different types of herniation. So number one, this uncal herniation. This is where you start to get eye deviations, pupil dilation. So on physical exam, you can already identify someone has something going on with their brain in that situation. Okay. This internal herniation here, that would crush the diencephalon. It comes in a myriad of things. Number three, when we get a shift in this midline here, and that will compress ACA and cause stroke symptoms, and eventually it is a stroke. It's just an obstruction at that point. Number four, this is usually someone that falls on the side, like off something and lands on the side of their head, or you see this when someone gets like T-boned and they whack their head against like the window, side window, something like that. Here, this one's pretty rare, cerebellum upwards. that one, there needs to be like trauma from below or obstruction here or something like along those lines. And then we can brainstem down as well. Okay. The red on the side there, that's referencing epidural hematoma. So this is head trauma. And what you're seeing here, you can see the left ventricle here. You can't see the right. All of it's being compressed. Everything's being shifted over. This is when someone falls skiing, car accident. I know 2 people personally that I know of. One was skiing, one was car accident, and they both died from epidural hematomas. Head trauma, it doesn't take much. Okay, one was like 23, 24, skiing accident, and passed away from it. My wife grew up with him. I knew him once I moved up here, kind of thing. And the crazy part, he was out in China when it happened. So to get him back over here, it was just a giant ordeal. And then the other one was a car buddy. He was racing out at Road Atlanta, and he went off, and when he came back, he overcorrected, and he slammed into the wall sideways like that. Wearing a helmet, had a cage in the car, but he didn't have the right seat in the car. So when you have like a cage, you're supposed to have the seat that has like the wings that come out like this, so that if you hit that, the soft area. Well, he whacked the cage. And so he was like, oh, I'm fine. Wouldn't go with EMS, and about an hour later, didn't feel so good. They took him, and from what I understood, is by the time they made it to the hospital, he was unconscious. Never woke up. Right? Subdural hematoma. So this is below the dura. That's blood coming through the dura. That's all coagulated blood. So this is, extreme damage. This could be shaken baby syndrome, for example. They sever vessels in there and they bleed. Right? So we talked about vasogenic, the leaky blood vessels, the metabolic, that's where the sodium enters, and then interstitial, that increased fluid. Right? So there's not enough flow. There's hypoxia. All right, hydrocephalus, communicating and non-communicating. So non-communicating, there is an obstruction. Okay? There's on that image. There is an obstruction here. The CSF is made up here. Was it epidemial cells, something like that. And so they're producing it, and then it's supposed to flow through all the ventricles, and then flow down and be absorbed, go on the outside here, be absorbed. If there's an obstruction, they just produce, swell. Okay? Communicating, they're making it, it's flowing, but there's no reabsorption for some reason, or very low reabsorption. And so it creates this hydrocephalus as well. They used to call these, there's babies that'll be born with the non-communicating, and when they are, because the fontanelles of the skull are still open, their head will be super swollen like this from all the fluid, and they used to call them water babies. Just pretty crazy, because I'm pretty sure we have some sunscreen, and the brand is Water Babies. I don't know why I just thought of that. Yeah, my brain goes elsewhere sometimes. Strokes. So strokes are really due to ischemia to the brain. Okay? Whether there's a block in the vessel, or the vessel explodes, or there's compression. Okay? So any of those. So TIA, transient ischemic attack, they have symptoms of a stroke, and then it disappears real quick. Oh, I'm fine. Let's go. Keep on going. Okay? That's TIA. Thrombolytic therapy. This is where we're giving TPA. You have the first 4.5 hours to give it. This is a life-saving medication. So this is why it's important. People need to get to the hospital as quickly as possible when they have any of these neurological type symptoms. Time matters. Cannot stress that enough. Anything that messes, vision goes weird, they're acting weird, they're speaking weird, moving weird, time matters. Okay? They go unconscious and come back for no reason. it needs to be evaluated. They may have had a TIA, they passed out, they came back to, and they could have a stroke at any point in time, right? And that fall itself could cause damage. It doesn't take much, especially when they're older. Okay, falls are important to be mindful of. I got to tell a horrible story about my wife. This one's gonna live in infamy. So my wife, she used to have to go speak with patients, educate patients in the hospital about, if they're getting started on anticoagulants, how to take it, what to watch for, and then fall risks. And so one of the big things, they talk about is, like, if you have area rugs, make sure you get that double-sided tape. You, like, stick them down or get rid of them, because that's usually what people trip on is, like, area rugs, right? And so she goes in to talk to this patient, and the patient's like, I'm fine, I don't need to worry about that. She's like, no, this is important. Like, you need to be mindful of this. Like, falls are a serious thing. He's like, no, I really don't need to worry about that. And she kept on pushing. The dude gets fed up and pulls the covers back, the sheets back in his hospital bed. He's a double amputee. Read the patient's chart, people. She's like, I felt so bad. I need to remind her of that one. That's a classic. Anyhow. Thrombotic stroke, so that's an occlusion, and then hemorrhagic stroke, that is a rupture. So, a lot of times they'll say, like, just give them aspirin, chew up aspirin, give aspirin. That's fine if it's thrombotic. If it's hemorrhagic, you're going to make it worse. So the best thing, EMS, they can do bedside imaging once they get there, and we can deal with it, kind of thing. Okay. And bleeds, the big thing is high blood pressure. That's why maintaining low blood pressure throughout your life is important, because every time your heart beats, you stretch your vessels, and you're stressing them over time. And eventually they fatigue and they can give. Okay, so having these blood pressure spikes or constant high blood pressure is a problem. AVMs, arterial venous malformations, that you're born with. That's just the ticking time bomb you don't know you have. It is a misformed vessel. It has an outpouching. It's missing, like, tunica media, for example, the strong layer inside your arteries, and blood pressure gets high and it just spontaneously ruptures. My wife, someone she grew up with, had one. I think they were like late 20s, and it just spontaneously ruptured, and she didn't make it, unfortunately. Which is, like, I think last year that it happened. Anyhow. So yeah, strokes. The problem here, like I was saying, these are watershed areas. Like, this one vessel feeds a big area, so they can have massive loss, small loss. It's you and your luck. This is a hemorrhage. That's all blood in there. You can see it in the ventricles. Right? Aneurysms, so these are outpouchings. These are the AVMs, all right? So that's what they're pointing to there. You can see that bubbled area. If it ruptures, they can have blood in the CSF. There's really only 2 times you talk about blood in the CSF, maybe 3. Aneurysms, trauma, and herpes. Cold sores, it's stored in a ganglion, it comes out the sensory, cold sore. Well, if it goes the wrong way, it goes to your brain, and it causes herpes encephalitis, and it usually attacks the temporal lobe for some reason, and you'll have bloody CSF. Fun fact. I had a student years ago told me she had it 3 times. For some reason, her cold sores decided to go the other way, essentially. Okay. Brain tumors, there's a variety out there. Astrocytomas aren't that bad. They can be treatable, but glioblastomas, those are bad. Those are usually not treatable, and you can see as it grows here. Look at the shift. Look at the compression of the ventricles. Okay. Very, very bad. Usually inoperable. Meningiomas, these are the safer bet. Okay, and that's of one of the Duras. Okay, or the Maters, Pia Mater. Okay, they'll have symptoms because it compresses the brain, but usually we can surgically remove it and deal with it. Motor function. So one, there's crossing of the nerves. So if you have something go wrong on one side of your brain, the opposite side of your body is affected. Face, it's on the same side. Okay? Then, depending on where the severing is, it can be just lower body, one arm, one leg. It just really depends on where the lesion is. Okay? Huntington's. So this is another neat one. So repeating CAG, I believe we talked about this. The chorea, the movement of arms, limbs, okay, and big cognitive impairment. Remember, it happens earlier and earlier and earlier. Tourette syndrome. So this is involuntary movements, sounds, clicking, stuff like that. They cannot help themselves. It does a lot of times come with OCD. The obsessions that they cannot control. It can be inherited. Okay, so there's like a new-ish show out, documentary that's really interesting, and that's I think it's Balin Out Loud is what it's called. There's like a girl that's very famous for her Tourette's. She's a big supporter and like educator on Tourette's. And so she has this big social following to the point where TLC made a show for her. And it's interesting. I mean, she talks about a couple of her family members do have little tics, stuff like that. There's your inherited. But hers is so severe. I mean, it's wild. She has the version where she will curse as well. So if you have the opportunity to watch it on TLC, it's edited on I think it's HBO Max. They have the unedited version. I mean, it's hilarious. Like even her family is just like, oh God, why? Like some of the stuff she says. But yeah, if she sees a bald person, she has to let them know they're bald. I don't know if I'd be her fan. Anyhow. Parkinson's, so here there's loss of inhibition of function. What that means is when they start moving, they have trouble stopping. They also have a problem with initiation of function, so getting them to start moving sometimes takes a bit. They'll have cogwheel movement, so when they move like their arm, it moves just like a cogwheel, like that. So yeah. They have what are called Lewy bodies in there that build up. Excuse me. Shaky hands. They get tremors. Okay? And then pill rolling. That's another thing they'll do. The shaky hand is not necessarily a sign of Parkinson's. There's also what's called essential tremor. The difference is this. If you have Parkinson's and you write, it's all messy, okay? Messy as could be. If you have essential tremor and you go to write, your hand steadies. The other way to tell is if someone has essential tremor, if they have like a glass of wine or a beer, that little bit of alcohol stabilizes them. They'll say, oh yeah, my tremor disappears. They have essential tremor, okay? Parkinson's, it's bad. I mean, they lose functionality, forget how to do stuff. It's another dementia. So yeah, I had a guy hit my car one time. I parked real far, and he clipped like my back corner as he was turning in with his vehicle, and it was like a new Escalade, and every corner was hit. And so it was a private parking garage, of course. Left a note. He actually contacted me. And so I was telling him, I was like, yeah, you just kind of clipped the back corner. I don't know if you noticed it. And he's like, I don't. He's like, but I believe you. He's like, I have Parkinson's. And so even when he sent me his information, it was typed up. He didn't write it. which I thought was interesting. But it's probably because his handwriting is so messy. But I mean, if you think about it, he saw the parking spot. He decided he wanted to turn in there. Problems initiating, so he started to turn late. And then if the cogwheel is there, he can't move swiftly. And then when he realized he's probably going to hit, it took time to hit the brakes. Okay? And that's if he even noticed it. I mean, he just may have not noticed it, may not realized it. So, it is what it is. 'Tis life. That's why we have insurance. ALS, or amyotrophic lateral sclerosis. So this, depending on where it's at, causes upper motor neuron spasticity. Sorry, if it's in the upper motor neuron, there is spasticity. If it is in the lower motor neuron, it is flaccid. What the heck does that mean? Let's get a pen. So, come on, pen. So let's say this is your spinal cord. We have a line leading out to muscle. Line leading back in. Okay, let's draw some arrows here. And then we have brain down to spinal cord. If the lesion is here, that's your upper motor neuron. Okay, or brain, somewhere above that level of spinal cord. There is no signal coming down. There's no signal out. There's no signal back in. Okay. What's happening here is there actually is a signal out. There is a signal back in. There's no inhibition. See, what's happening is the spinal cord is sending its own signal. It has that ability. That's where reflexes come from. It's this own internal section here. And so there's signal out, but there's nothing to inhibit, and so you get spastic paralysis, flexion. If it is here, that's your lower motor neuron. There is no electricity impulses being sent to the muscle. It's just flaccid. Okay? That's your lower motor neuron damage. Glutamate toxicity. Really what this just comes down to is there's excessive glutamate being released, typically with strokes, and it can damage the neurons directly. Keep it simple. Okay. MS. So MS is autoimmune. It's random where it affects, and what it's affecting is the myelin. So the sheath, the insulation around your nerves. If that's damaged, electrical impulses don't travel through or travel through very weakly. Where it happens is different in every person. This is why immunosuppressant drugs are very important in these populations, because every flare-up is permanent damage. Okay? So it can be anywhere in the body. It's you and your luck. What is affected, right? Guillain-Barré syndrome. This is a pretty neat one. Very commonly seen after Campylobacter infections. Causes diarrhea. Associated with poultry. Okay. So he actually, it's kind of neat. I'm going to draw it because I think it's neat. Remember when you were a little kid and you used to draw birds and you draw something like this? Well, that's what Campylobacter means. And it comes from poultry. Birds. Memory tool for when you take micro if you have to. All right. And then viruses. So CMV, cytomegalovirus. Viruses in general. They're so tiny, they confuse the immune system. Coincidentally, so are vaccines for viruses. So I've heard stories of people getting viral vaccines and it triggering Guillain-Barré. It's not the vaccine, it's your own immune system that's just having issues. Yeah, you would have gotten that. You probably would have gotten Guillain-Barré with, like, when you caught the flu one time or something, okay? There's a lady from our church, she's had Guillain-Barré twice. She caught COVID, developed Guillain-Barré. To the point where she was partially paralyzed. So it's an ascending paralysis. It starts in your feet and goes up, and then it gets your diaphragm. So she was hospitalized for a period of time twice. Okay? But she's recovered. They'll recover. The myelin will come back. As long as they don't die from breathing issues or infection, but we have modern day medicine, so not a huge concern there. Myasthenia gravis, so this is where the acetylcholine receptors are destroyed by your own immune system, okay? T cells damage it, and so they lose the ability for stimulation of muscle. So they usually come in with the droopy eyelids. That's the first sign. They'll say, like, end of the day, I can't even turn the doorknob. I'm so fatigued. Stuff like that. Why is it? Okay, there we go. Degenerative joint diseases. So you have spondylolysis. So that's when they crack the actual lamina in here. Typically it's from trauma. So, tumbling or landing on it, getting kicked in it, something like that is where you start to see it. And so they get these little pieces that break off, and they can cause stenosis of the spinal cord, and so they have to be surgically removed at that point if that happens. And then herniated discs. So the disc is contained, okay, by what's called the disc annulus. When there's too much pressure, or you pinch it, you rupture the annulus. When you rupture the annulus, the disc itself, the nucleus pulposus, will push out. When it pushes out, it pinches the nerve. That's a pinched nerve, okay? Depending on how bad it is, you can have pain, you can have weakness, burning sensations. It depends on what nerve it's pinching on, how bad it's pinching on or compressing. One of the best things you can do, lose weight. As we gain weight, it's more that our spine has to carry it. It pushes down harder. So losing weight is one of the best things. And then if it's extreme, they can remove the disc. They can do a fusion. They can put in a little spacer, the synthetic disc or prosthetic, and deal with it that way as well. If it compresses the cord itself, that's where you get the stenosis, spinal stenosis. That's where they're doing that new laser therapy. That's one of those situations. They can just fry that little piece, and hopefully that's sufficient to get the compression off of the nerve. Thank you, and I'll see you later.